Good morning. I'm joined by Alyssa Bolt, hardworking nurse here, and Trudy and Dr. Shaw. And we have had just a conversation. Dr. Getz is with us as well. I think you know Dr. Getz. We've just had a conversation with some of the most heroic, inspiring people in the state of Washington, and that is our medical care providers, our nurses, our respiratory therapists, our custodians, our administrators. The inspiration per square mile here is as high here as it's ever been in the state of Washington, because we have heard stories of nurses, therapists working unbelievably long hours, having to care for people who are suffering preventable death. And they have been undissuaded by exhaustion. They have worked through the mental health strain that they have being alone with patients who are losing their lives in a loss that may have been entirely preventable. And they've expressed to me how difficult that is and how committed they are to their mission statement and how they're committed to their teams as well. And I just have to tell you, it is so inspiring to know that in the midst of a pandemic, we have the number of heroes that we do in the medical healthcare profession. And obviously, it's not just in Spokane County, it's across the state of Washington, because it's the same situation to some degree in all of our communities. So I just have to tell you, I'm a governor who's very inspired this morning to know we have a group of people who are so committed to the lives of their fellows. And I heard some of those stories firsthand. But I also come away with a concern and a frustration that we are in a situation that does not have to be this way. We have the power to prevent these preventable deaths that is not being used, and that's the vaccine that is a lifesaver in this community. And the consequences of this are not only nurses who have to hold the hands of people who are losing their lives. Sometimes at age 20, I heard about a young man aged 20 lost his life recently in Spokane, entirely preventable death. And we are having to ask nurses to hold the hands of these dying patients of a preventable disease. And that's hard on these nurses to have that knowledge. They're doing the best they can. They shouldn't have to be in this position to hold the hand of a person who's dying from a preventable disease. But they're doing the best they can. And there's another reason this is extremely challenging and frustrating. I've been told that there has been over 2,000 surgeries that have been prevented or stopped because we don't have room for these surgeries. These are women with breast cancer, people with brain tumors, people with cardiac problems, haven't been able to get their surgery here in Spokane County because of a very specific reason, and that's people aren't getting vaccinated. So we have 2,000 people in Spokane County today who haven't been able to get their cancer treated, for goodness sakes, because we have other thousands of people in Spokane County who haven't been willing to get this vaccine. That's very discouraging, and it needs to change if we're ever going to get these people surgery, because we have limited space, we have limited surgeons, we have limited operating suites, and we have limited nursing capacity. The reason I point that out is that obviously we feel absolutely heart-stricken at the thought of people losing their lives when those people did not have to lose their lives. But that failure to become vaccinated is a threat to everyone in Spokane County, even if you never get COVID. It is a threat to our ability to get medical care, and it has been significantly reduced as a result of people who have refused to get this vaccine. Now, I've also heard this problem has been compounded by the fact that we have been good neighbors helping our friends in Idaho. And I'm told that there are as many as 30 patients a day that we're having to care for, more than we typically would, that are coming from Idaho. We care about people's lives in Idaho. But I have to tell you, as governor of Washington, it is frustrating that politicians in Idaho are not helping on this subject. And as a result, we have 16% higher vaccination rates in our state than Idaho. We have 13% higher in Spokane County than in Kootenai County. And as a result, the infection rate in Idaho is almost twice as high as it is in the state of Washington per 1,000 citizens. Idaho's not pulling their share of the load here. And the politicians' failure to act is jeopardizing my community in Spokane. And I'm not happy about that. We should all be pulling on the rope here. And we need Idaho to pull on the rope to try to reduce these infection rates so that people in Spokane County can get into a hospital bed and get their surgery for their breast cancer. My breast cancer survivors deserve surgery, and they're not getting it today because politicians in Idaho aren't doing their job. So that needs to change as well. So we are all committed to helping these hardworking people in the medical community. We're trying to increase our supply. We've asked for the federal government of assistance to get additional nursing staff and the like. We're looking everywhere we can to get them help. But ultimately, we need more people to come into the profession. We need a way to help these folks with some of their mental health challenges. This is very, very difficult. And we need to be creative as possible to help them. So I'll end my comments there. I'm both an inspired and frustrated governor about what I've heard today in Spokane. Do you want to make some comments?
Thank you so much for having me here at this table today. And thank you for giving us your support. We really appreciate it. I would just wholeheartedly wish that we can come alongside people who are fearful of vaccination and really guide them in a compassionate and listening manner, and stay away from the shame and the blame. I wish that I would just love to have conversations with people and really just hear them where they sit. There are fears that sometimes are very valid that we can address by having a relationship with someone. So thank you.
Thank you. Thanks for sharing your story with me today, too. It was your commitment to your team. Alyssa told me, babe, if I may, the thing that keeps her going is her commitment to her team members. And it's been very difficult, but she's made a decision to stay through this pandemic and work with a tremendous team. So thanks for being a great team member. I know they appreciate it. Please thank them.
Absolutely.
Daily,
every day.
Hourly. Hourly. Dr. Getz, do you have any comments? Or?
I think just the vaccine's safe and effective. We are just tired of seeing people die that shouldn't die, that should be around. Every time you hear stories about these people that die and it's preventable, it whittles away a piece of your soul. And I think Alyssa can speak to that, caring for them at the bedside. And I encourage you to have a discussion with a healthcare provider in your community to address those questions, because it's overwhelmingly safe when we look at the data, and there's no need for these people to be getting sick and to end up in the hospital. So just keep yourself safe, keep your loved ones safe.
Dr. Getz, who would you recommend people, if they have questions about the vaccine? Is it safe? How does it work? I mean, who would you recommend people talk to about that?
I think having this discussion with a healthcare provider in your community, just like Alyssa had offered, an incredibly knowledgeable nurse, these people that understand, one, the science behind the vaccine, two, that also have the perspective of how sick this makes certain people. I'm willing to discuss with anyone what we know and what we don't know. And my family's vaccinated except for my 10-year-old because she's not old enough yet. But the science and the data and what we see, the tragedies, is overwhelming enough that it makes sense to take care of yourself and your family. And it's not just for you, as you mentioned, these surgeries, these 2,000 people that can't get the care that they need are having to wait until we have the capacity. And that's directly responsible right now to low vaccine rates. And it's not just Idaho, it's also Eastern Washington. We have some work to do to catch up with the rest of the state.
So we'll need to transition to the Q&A portion really quickly.
Okay, so we're running a little short on time, so we're going to focus on Spokane media. First question comes from Rania with KXLY.
Hi, Governor Inslee. My name is Rania. Nice to meet you. Are you expecting a lot of people to quit their job as a result of the vaccine mandates and the healthcare workers being, required to get the vaccine?
No, we think the vast, vast majority of healthcare professionals and educators and state employees will remain committed to their public service. These are very committed people. They're hardworking, they're doing great work. And we think the vast majority of them will continue in their work. That has been the experience in other places. We've reviewed some of the experience in New York and with United Airlines, and they're having numbers of 98% people continuing in employment even after we've had these vaccine mandates. Our experience with our state employees is encouraging in this regard. We've had about a 20% increase since the mandate went into place of people who report being vaccinated. So we think we're getting a lot of people vaccinated as a result of this. And as people come closer to this deadline, I'm very confident that more and more people will make this life-saving decisions for them and their families and for their communities, frankly, because this is a community issue. When people don't get vaccinated, they put everybody at risk. They prevent people from being able to get surgery for cancer. They put their children and their grandparents at risk. And more people are coming to understand that. And this is just helping them think about this, frankly. It's just asking people to think about this. And when they think about this, they're making decisions to get vaccinated. Now, for those folks that do decide to leave employment, we have contingency plans to make sure that we keep public services going. I'm confident in those plans. And we've been very thoughtful about making sure that that's going to happen. So I believe as a result of this, we will have more vaccinated people. We will continue to have good services provided. And most importantly, we're going to save a lot of lives in our state, as we already have done. We're very proud of our state. We've saved thousands of lives compared to other states. And we're going to continue to do that.
Next question comes from Rebecca with Spokane Public Radio.
Hi, Governor Inslee. This is Rebecca. My question is, I've heard in other states that they've maybe mobilized the National Guard as their vaccine mandates go into effect. Here in Spokane, some of our nursing facilities specifically have much lower vaccination rates. Is there some potential in contingency plans that could include that to maybe help out with any lost staff that could happen in some of our facilities over here?
Well, at the moment, our contingency plans does not include a mobilization of the National Guard because we have other assets to bring to the table. So we really doubt that that would be necessary. One thing you have to understand about the National Guard, there are some nurses and doctors who are in the National Guard, but they're serving in the private sector already. So if you have a physician who's working at a hospital, just putting them in a camo uniform and have them doing the same work they're already doing doesn't really add to the situation. And the greatest shortage that we need are medical professionals. So the medical professionals who are in the Guard, except for a very few, are already working in the community. So we don't really add much capacity in that regard. Now, there are some jobs we can do in hospitals and long-term care facilities where non-medical personnel could be of assistance, food service, security, that kind of thing. The Guard could potentially be available, but that is not part of our contingency plan at the moment because we have other ways to deal with those services.
We have time for two more questions. First comes from Tim with KREM.
Hi, Governor Inslee. This is Tim with CREM in Spokane. My question is also about the vaccine mandate. I want to ask, what is your plan to address potential worker shortages for our schools? I know you talked about contingency plans for state workers and hospitals and nurses, but what about teachers and bus drivers?
Well, first off, our plan is to get as many people as possible vaccinated. So we're trying to make it as easy as possible. We're trying to provide information for people. And now we've provided this mandate that's going to help them get vaccinated. So the best way out of this problem is to get people vaccinated. And that's what we're doing. And we're having good success, as I've indicated, in that regard. But we do have plans, schools do have plans. They involve some changes in their operations. There's new recruitment efforts for bus drivers, which has always been a chronically problem, by the way, and let us show our remorse for losing our great driver in the Tri-Cities the other day. We just are heartsick about this fellow who lost his life, and the bus drivers are such an important part of our educational community. The kids love them. They're unbelievably professional in what they do. And we have already had pre-existing efforts to try to end what is a national shortage for bus drivers. So this is part of an ongoing effort. But the districts have been as intentional as possible to have plans, and they do have plans to deal with potential shortages to the extent they exist. But we believe that will be a lot less than some people have feared because people are getting vaccinated, and that makes sense.
Final question comes from Ariel with the Spokesman Review.
Thank you. Governor, are you concerned about how far backed up elective yet critical surgeries are in Spokane and statewide, and how that'll impact our healthcare system in the coming months? And I'm curious if there's anything the state can do beyond your request to the federal government.
Yes, I'm extremely concerned. Look, in Spokane County, there's 2,000 people that haven't had their surgery who deserve to be able to have their surgery today. And the reason they have not been able to have that surgery is we don't have enough people who've been vaccinated. It's just a clear statement of fact. So what we are doing is, first off, trying to encourage people to become vaccinated, enable them to get information so they can make a good decision, and make sure that happens. That's the most important thing we can do. And we're doing a relatively good job on it. We're close. I think we're in the top 10 of vaccination rates nationally, and we tend to always want to be number one. But the other thing we can do is increase the number of people, of nurses and physicians. And we're doing everything we can. As I've indicated, we've asked for some federal assistance in this regard. I know the hospitals are trying to recruit. It's crazy. They're offering bonuses as much as they can. But ultimately, we have to increase the supply of nurses, because otherwise we just have hospitals fighting each other for a limited nursing supply. So the ultimate answer is to get more people into these professions. Now, unfortunately, that takes time, unfortunately. But we're going to, in the next legislative session, to try to increase that capacity as well. But that's ultimately the solution here.
Any final words, Governor?
No, my final words is to thank you to the medical people, the nurses, the doctors, the physical therapists, the respiratory therapists, the custodians, the guards. Thank you, thank you, thank you. You are doing something that is absolutely heroic. We should mint some medals for everybody when this is over, or we're back to a stable position, because these people deserve it. And I would encourage everybody in Spokane, hug a nurse or a respiratory therapist, or even a doctor. Pardon? And besides hugging them, get a vaccine. That's what they really need right now. And get your family member to be a vaccine. Look, the nurses and doctors are not the only lifesavers here today. That's maybe I should mention. We all have kind of a unique thing in life that maybe we've never had before. And that is, we can save people's lives, literally. You don't have to go to med school today to save a life. You can talk to your uncle who's been a little reluctant to get the vaccine and say, Uncle Charlie, we love you. You know, what's your concern? And Uncle Charlie says, well, I heard that, it'll hurt your part of your body or something if you get it. And say, okay, Uncle Charlie, let's call our nurse friend over here and ask him or her about it. Those conversations are life-saving today, literally. And that's a very unique blessing to be able to save somebody's life. So I hope more and more people in Spokane will become lifesavers as well. You may never be a doctor or a nurse, but you can be a lifesaver. I hope people will engage in those conversations. The more of those conversations, the more lives we're going to save. The more people are going to be able to get in to get their cancer surgery, and the more we get this behind us. I'll mention one other consequence of this. We're trying to keep our schools open. It is a joy that our schools are back open. It's a joy for us, joy for the teachers and the kids. But listen, we've had 2 schools already closed in the state of Washington because of outbreaks. And we just don't want to see that becoming an ongoing problem, that we have to go back to remote learning. But that may be the case if we don't get more people vaccinated. So if you love your family and if you love your kids, please get a vaccination. With that, thank you very much. Be well. And again, Alyssa, thank you. Dr. Getz, thank you for your professions. Be well.